And you're saying it affects the immune system. So, autoimmune conditions have exponentially increased in my practice and clients. With these type of autoimmunes, rheumatoid arthritis, ulcerative colitis, things like Sjogren's syndrome, multiple sclerosis, Hashimoto's thyroiditis. Just tell us about your success and your process that you use with regards to autoimmune.
Yeah, so for autoimmune, the go-to is the IV. And we've found that doing about 1.4 million per pound of body weight, which is 3 million per kilo, is sort of, think of it like a parabolic curve that starts to flatten out at the top. You hit this point of diminishing returns, right? So for someone like me, I weigh about 240. So realistically, I would probably do like a 400 million IV for my body weight. But let's do easy math. Someone 150 pounds, that's 200 million IV. Them doing a 400 million IV isn't going to give double the results because you hit this point of like peak effectiveness. So you can increase the dose even higher, but you're not going to get double the results. So with autoimmune disease, we found that's kind of the perfect range. And they go in systemically and they interact with the immune system. They're mainly sending out these specialized cytokines that influence the immune system. It's sort of like hitting the factory reset button. Your immune system, whether you've got rheumatoid arthritis, ulcerative colitis, MS, Sjogren's, it's attacking the body when it should be protecting it. So this hits it back to factory reset. It stops attacking, starts protecting. And the cool part is it seems to last. It's pretty rare that it wears off. We've been doing this for 8 years. I have patients from 8 years ago with some of these conditions that are still in remission. That doesn't mean it might not flare up in the future. Something might not happen, but the results seem to really last a long time and sticks with it. Now, for certain issues like, say, Hashimoto's, because it affects the thyroid, we also do an injection to the thyroid just to help with inflammation there and to hit it more direct. And that's actually increased our success rate there at getting all the TSH and T3, T4 all back in order. Where with MS, we add the intrathecal because even though we fix the immune response, we want to fix those lesions in the spinal cord of the brain. So we go intrathecal to help speed up that process. So most of them are just an IV, but for certain ones like rheumatoid arthritis, we might have to go to the joints if the cartilage is too worn out because cartilage gets very little blood flow. So an IV is not going to fix your arthritic knee. You need to go direct. So yeah.
Brilliant. And what is your success rate with autoimmune conditions? 'Cause, I mean, this has become a significant problem. Are you getting a very high
Definitely.
success rate? And how many sessions do
Yeah,
they need? I know it's patient specific, but these are the questions I get to say, you know what, I've had
totally.
ulcerative colitis for 10 years, and how many sessions is it going to take?
So it's everybody's different, right? We always hope it's one and done. That's our goal. That's why we use so many cells. Most patients are doing, 2 or 300 million for one of these issues. But there are some cases where, like that neurologist who was just here from New Jersey. I mean, yeah, we did an interview. He said he's like 80, 90% better, still a few little gut health type issues. So he came back again this year. I mean, it was tolerable. He would have been fine, but he wants to be perfect. So in a case like that, we get someone 80, 90% done. They might be fine with that. Other people want to come back and do it again to knock it out and be done
One
with it.
session, one IV. And
Yeah, one
and how
IV.
long did he have ulcerative colitis for? And he's a doctor, neurosurgeon.
Yeah, and he's tried everything. I mean, if anybody's going to try anything, it's a neurosurgeon, right? So he's done it all, and this is the first thing that's really helped him. And it was one session. That was a year ago. And yeah, I just posted that video a few weeks ago, so you can take a look. But we have a lot of people like that one session's typically enough. Sometimes it takes more than one, but I'd say about 80% of the people, it's one and done. They get the results they want. There's about 15% of people that maybe need a second session, especially someone like him that's had this for like 20 plus years. It seems like the longer you've had that autoimmune condition, the higher the likelihood you're going to have to do like a second round. That's what we found. Um, and yeah, 15% of people have to do it again, and 5% of people are just non-responders. That's what we've seen in our clinic. And if you read through the literature, that's what most of the studies actually work out to too. And we don't know why. Some people just don't really respond to it. And diet has a big effect on autoimmune too. I think there's a big connection with what they're spraying on all the foods and GMOs and all that. I mean, who knows? I can't prove it, but I wouldn't doubt it. So you really want to help people with their diet to make sure that they don't bring it back from eating the same things that caused it in the first place.